Each facet of dentistry seems to have its own window of advancement. Periodontics, aesthetic dentistry, implants, and now endodontics. Conventional endodontic files and gutta-percha techniques and viscosities were without change for nearly a century. The recent utilization of new materials and enhanced manufacturing capabilities have ushered in a new era of endodontic advancement. TICOM is the leading edge in endodontic advancement. The first to introduce nickel titanium hand files and engine files and varying viscosities of gutta-percha, TICOM now carries endodontic instrumentation and obturation to even higher levels of efficiency and effectiveness, assuring success and expediency for endodontic treatment. This is MicroSeal. MicroSeal. It completely seals the root canal in all its dimensions, independent of what the morphology of the canal might be. Before exploring the simple hands-on technique of this extraordinary obturation procedure, it is best to review the foundation of good obturation. The foundation of good endodontic obturation is a canal system that has been cleaned and shaped in all its dimensions. However, once cleaning and shaping have been accomplished, the complete seal of the root canal system is an essential component in assuring long-term clinical success, as it is the seal that maintains the barrier between the oral environment and the periradicular tissues. With the passage of time, the potential sites for bacterial invasion increase as restorations wear and as the gingival cuff migrates apically. The essentials of an excellent barrier begin with the assurances that the apical preparation has been properly sealed. The seal must not only be possible theoretically, but also must be accomplished in such a manner that the clinician is able to verify this aspect of the treatment each and every time. The most tried and true method of ensuring a complete apical seal is to fit a master gutta-percha cone to achieve what has been referred to as tug-back, confirming that the cone fits snugly into the apical preparation. Even though fitting the master cone is often verified radiographically, a disparity between the prepared shape and the cone could lead the clinician to have a false impression of a three-dimensional fit. If the gutta-percha were specially processed so that the pressure of a spreader permitted the master cone to automatically conform to the shape of the canal prep, you could create the beginning of a sealed system more impervious to future contamination. MicroSeal does just that. By using a master cone of custom phase gutta-percha, the initial tug-back is enhanced by the pressure of a spreader seated just short of the working length. After the spreader has been removed, the void that is created allows for the placement of the MicroSeal condenser, which has been coated with plasticized MicroSeal Easy Flow gutta-percha. The MicroSeal Easy Flow gutta-percha, which has been heated outside the tooth, has two distinct properties. First, it flows readily into all areas of the canal space after being heated. And secondly, it adheres to all surfaces. Research has established that heating gutta-percha enhances the clinician's ability to compact it into canal eccentricities. However, standard gutta-percha shrinks as it cools, creating voids between the gutta-percha and the surrounding canal wall. To prevent contraction from occurring, other obturation techniques that use heated gutta-percha recommend that the gutta-percha be placed into the canal in small increments so that vertical pressure can be applied while it cools and thus maintain contact with the canal wall. Even though vertical condensation is effective, it is also technique sensitive and extremely time-consuming. By using the MicroSeal system, the clinician need only fill the canal, and the adhesive nature of the gutta-percha leaves the filling attached in all dimensions. The coated MicroSeal condenser is placed into the void created by the spreader alongside the Mastro MicroSeal cone, and using a slow-speed handpiece, the condenser is rotated at 5,000 to 7,000 10,000 RPMs. The rotation of the MicroSeal condenser causes the MicroFlow master cone to fuse with the gutta percha from the MicroFlow cartridge. Apical control with the MicroFlow master cone is maintained, while the more fluid material from the condenser is forced into canal intricacies. The rotating MicroSeal condenser should be held in place for no more than 2 seconds, resisting the natural tendency of the condenser to move coronally. The MicroSeal condenser should then be slowly withdrawn coronally while maintaining physical contact with the canal wall. Rotation should be continued until the MicroSeal condenser is fully removed from the canal. The placement of the spreader alongside the MicroFlow master cone seals the apex, and the mechanical action of the condenser simultaneously introduces, adapts, and condenses the gutta percha into the balance of the canal, ensuring an excellent seal for the canal system. Now let us begin the MicroSeal technique segment. Prepare the canal for obturation. Successful root canal treatment depends on proper cleaning and shaping of the canal. However, excessive flaring is unnecessary for MicroSeal obturation. Dry the canal. The interface between sealant, gutta percha, and tooth structure is more complete and effective in the absence of moisture. Therefore, drying the canal is essential. A MicroFlow master cone of a size appropriate for the prepared canal is fit with tugback, and its position is confirmed radiographically. Sealer is placed into the canal, ensuring its even distribution. The heater is turned on, and both the red and green indicators will light up. In approximately 30 seconds, the red light will go out, indicating that the appropriate temperature has been reached. The MicroFlow master cone is reintroduced into the canal, and a MicroSeal spreader is seated alongside the master MicroSeal gutta percha cone, locking it in place. The spreader is withdrawn, creating a void. A syringe of MicroSeal EasyFlow gutta percha is placed into the heater. After 10 seconds, the syringe is removed from the heater, and the MicroSeal condenser is inserted into it to the depth of the grooved portion. Steady pressure is applied to the syringe plunger as the condenser is withdrawn from the syringe, ensuring that a thin, smooth layer of gutta percha coats the condenser. Immediately carry the coated MicroSeal condenser to the tooth for insertion. Working time is approximately 30 seconds. Once inserted into the canal, the temperature of the gutta percha is approximately body temperature. Insert the coated condenser into the previously created void apically into the canal space to as close to the working length as possible. Do not rotate the condenser during insertion into the canal. Without applying any apical pressure, but resisting any backing out motion, start the rotation of the condenser to a speed between 5,000 and 7,000 RPMs, the approximate speed for conventional slow-speed handpieces. Leave the condenser in its apical position for no more than 2 seconds, and then slowly withdraw the condenser, applying gentle pressure on one side of the canal. Withdraw slowly, and do not stop the rotation until the condenser is fully withdrawn from the canal. Condensation time should be no longer than 6 seconds. To ensure sufficient volume of gutta percha has been placed into the canal, the spreader should be reinserted into the center of the gutta percha filling. If there is need for additional gutta percha, reinsert the condenser into the MicroFlow cartridge and coat the condenser with gutta percha. Carry the condenser immediately into the void and deposit the gutta percha as previously described. In multi-rooted teeth, remove excess gutta percha from the chamber by using a small, sharp spoon excavator. Always adjust the amount of gutta percha extruded onto the condenser so little excess remains in the access cavity. Repeat the preceding steps for each canal. As each MicroFlow cartridge is for single patient use, only one cartridge is necessary for the entire procedure. Many years ago, the father of modern endodontics, Dr. Louis Grossman, published a list of criteria that dealt with obturation of the root canal system. The criteria are as valid today as they were back then. The MicroSeal system comes closer to Grossman's criteria than any other technique. Grossman criteria include: material should be easily introduced into the root canal system. MicroSeal is simple and straightforward. Material should seal the canal laterally as well as apically. MicroSeal's master cone is fit and locks into place as pressure is applied with the spreader on the low-fusing gutta-percha. Backfill of the canal is carried out with an adhesive alpha-type gutta-percha. The material should not shrink after being inserted. The adhesive nature of MicroSeal's alpha-type gutta-percha leaves the filling attached in all dimensions. Additional Grossman criteria include: the material should be impervious to moisture. The material should be radiopaque. The material should not stain tooth structure. The material should be easily removable from the root canal if necessary. As with other proven gutta-percha sealer combinations, the MicroSeal obturation system meets the remaining Grossman criteria. TICOM is committed to continue to offer peerless excellence in the development of endodontic instruments, techniques, services, and education. We look forward to working with you in the future for all your endodontic needs. For more information or to ask about our starter kit specials, call 800-288-6484.